the greatest things to cultivate is the art of noticing. That's the difference between looking and seeing, between hearing and listening, between accepting what the world presents and what you want to see. To my mind, that's a faculty which is important. One of the things in organizational learning is a thing called as associative fluency. What it means is the ability to generate a wide range of connections or associations when you're confronted with an event, a word, or a concept. My problem is that whenever I see something, I always associate it with surgery. At that time, I thought, if I can improve my ability to see things, can I become a better surgeon? So the question which came to my mind was, can studying art make me a better surgeon? So I started reading and learning, and I realized that visual literacy is a very important faculty. Seeing is all right, but sight is a faculty you need to cultivate, how to perceive objects, how to interpret what is seen, and what to do. And I read this book which tells us that if you sharpen your perception, if you pay attention to art, this book tells you it empowers your thinking, your attitudes, your professional skills, and there is evidence that surgeons, police officers, lawyers, if they study art, their performance in their own profession improves. You learn to see some hidden cues. You can see things what others cannot see. Look at this painting. This is a painting by a Dutch painter called Hieronymus Bosch, and this painting is called The Conjurer. Look at this painting. What is happening in this painting? There's a conjurer. People are watching him with rapt attention. He has something in his hand. There is an owl in his box. There's a dog sitting here. There's a frog here. I don't know how many of you have noticed in this painting that the priest is here and somebody is picking his pocket. Small things get unnoticed. That's what happens. Most bile duct injuries in surgery happen not because of an anatomical anomaly, but because it's a failure to give attention, like what they called as looked but failed to see. The surgeon who does injury will majority of the time will say, oh, it was an anomaly, but we all know it's an error of perception. Look at this cholangiogram, how you can miss a thing. In this patient, there is an injury to the bile duct and the right posterior sectoral duct is separated. So when you see a cholangiogram, small things like this get unnoticed. So when you do a hepatococcygeostomy, you don't have to anastomose only the right and left duct, but you also have to anastomose the right posterior sectoral duct. So essentially paying attention for surgeons is extremely important. So you have to get the inner Sherlock Holmes of yourself out. Try to discover the big things in very small things also. Look at this painting. This painting is called a painting of a monk. I want you to concentrate on the painting. Can you find something unusual in this painting? If you carefully see this painting, there's a fly sitting there. Why the artist did it, I don't know. But you see, if you pay attention to things, small things come out. So what eventually you have to become is a first-class noticer. If you become a first-class noticer, there are abundant examples in the world. Billy Beane, who was a baseball executive, he started working on data of baseball patients which nobody else saw. Raphael Katzen, the famous marine biologist, paid attention to pesticides. She is responsible for our understanding of the damage caused by pesticides. Small observations. Warren Buffett, what did he do? He saw the behavior of companies not doing well. Our friend Jerry Seinfeld, what did he do? His observational comedy is based because of a keen eye for the absurd lurking in what we see every day. So small observations can make you do big things. That's what happens. This patient was referred to us for a tumor of the colonic, for the left-sided colonic cancer, and the referring surgeons missed a synchronous tumor on the right side because attention was not paid. Essentially, it's a question of paying attention. Look at this when I talk of small things. This is a very simple cholangiogram of a choledochal cyst type 1. Somebody who observes carefully will see the two ducts are coming very low down as the saccular dilatation starts. The pancreatic duct is very close to the where the saccular dilatation is, and a significant amount of the choledochal cyst exists in the pancreas. So by paying attention to these things, your surgery becomes careful. So in this patient, we did not go very deep into the pancreas because we knew that the pancreas duct can get damaged, and like we knew that the both the bile ducts will have two ducts when we do anastomosis. That's what it appears. So in the same cholangiogram, somebody can see six findings and somebody will see only two findings. It's essentially a question of how you pay attention.